Let's talk about scoliosis, kyphosis, lordosis, and all of the osises, whatever that is, as it relates to vitamin D. Scoliosis is an abnormal curve from your back, like an S curve. So you're kind of like this right here. And then kyphosis is more of a hunchback. Okay, so you're over like this. And then lordosis is a condition where you have a sway back where your lower back is going too far in. It's an exaggerated curve in your lower back. Now, if you look up scoliosis, especially what causes scoliosis, you're going to find that they don't have a clue. They're going to say, well, it's environmental. They'll say that 65% of the cause of scoliosis is idiopathic, which means unknown cause. 15% is congenital, which I agree with, happens before you're born. And 10% is secondary to neuromuscular conditions. They don't really give you any more data on that. And they say 38% is genetics. But they say they haven't identified the gene yet, and it's very complex, which means they don't have a clue of what's going on. Now, there's a study out of Hong Kong that showed that 30% of people with scoliosis have osteopenia, okay? This is the start of bone loss. And this could be caused from a lack of calcium, but more likely the low amount of vitamin D3. If we take a look at D3 and we look up some of the symptoms of a vitamin D deficiency, look what we get. Scoliosis, kyphosis, lordosis, muscular spasm, bowed legs, knock knees, because vitamin D has everything to do with the development of your skeletal system, especially the spine. So it's so vitally important for a mother to have enough vitamin D when she's carrying her baby, as well as when she's breastfeeding. And the problem is that 50% of pregnant women are deficient in vitamin D, especially if you're African American. So if you are African American and you're a woman and you plan on becoming pregnant or you're going to do breastfeeding, make sure you take a good amount of vitamin D3. So let's say you don't have scoliosis or kyphosis or any of the major problems, and you want to know if you're vitamin D deficient. There's a couple quick ways to know. Number one, if you press on your breastbone or even your shin on your lower leg, if it's tender, that could be a sign of a vitamin D deficiency because one of the symptoms is bone pain. If you have a lot of muscle spasm, that could be another symptom. If you're depressed, that could be another symptom. Or if you have a weakened immune system and you get sick a lot, that is another big symptom. Now, if you're taking vitamin D and you're not really seeing the benefits out of it, it could be that you have celiac or some type of, damaged small intestine where you're not able to absorb the vitamin D from years ago. Let's say you took a lot of antibiotics and that destroyed the lining of your colon. So if that's the case, you're going to show vitamin D deficiencies or some of the symptoms. And if you take the vitamin D, you may not see the change. So you might need to take a liquid vitamin D and take greater amounts to see the change. Another common vitamin that works with vitamin D is vitamin K2. And usually if someone's deficient in vitamin D3, they're usually deficient in vitamin K2 as well. But just realize that vitamin K2 helps to prevent the calcium from accumulating in the arteries and the joints. Vitamin D3 helps the absorption of calcium by 20 times, absorption from the intestines to the blood. But we don't want to keep it hanging around the blood too much, so we want K2 to take it from the blood all the way into the tissues and the bone. So you need both of these to complete the job. So anyway, I just wanted to show you another very important connection of vitamin D to the shape of your spine. Thanks for watching.
Hey, we're back.
With another amazing recipe.
No grain, no sugar, totally keto. There's no suffering on keto.
Absolutely not.
And it's an immune system builder.
Absolutely. You have to check this out.
I think you should hurry up, watch the recipe, and make it yourself.
It's so easy to be keto.
Is it super easy?
It's super easy. We hope you enjoy making it as much as we are enjoying eating it.